Okay, so now that we've pretty well defined that fluid resuscitation in trauma patients, hemorrhaging trauma patients, is something to be careful about and how impactful that can be, it would make sense to look at our system and sort of answer the question, how much normal saline are we giving our trauma patients? So what we're seeing on the screen here is every dose documented in image trend, um, every normal saline dose documented in image trend for a step 1 through 3 trauma patients since 2016. And each box represents, let's show you guys here. So this orange box is an example, represents patients or doses documented as 100 milliliters. And it's 7.64% of doses that were 100 milliliter doses. What should stand out, I'm sure it does, is this big 52% box over here, which represents 1 liter. 52% of normal saline doses that we documented since 2016 for step 1 through 3 trauma patients were documented as 1 liter. It's likely, we know that most, 52% of our step 1 through 3 trauma patients did not need a 1 liter fluid bolus. Most of these patients had a blood pressure well above 80 and didn't require any fluid resuscitation at all. So what we are confident is going on here is that we just have to standardize how we document saline doses. For some reason, we have a tendency to document 1 liter because we use the 1 liter bag, and we don't want to do that. As you can see, it's really important for us to be able to look and get a clear answer on how much saline we're giving our hemorrhaging patients. So rather than documenting 1 liter because we hung a 1 liter bag and attached it to the line, we should document the actual volume we administered. For example, you can think of this similarly to epi. If you were to open a preload of epi and give some partial dose to a pediatric, you wouldn't document the whole milligram just because you opened the entire preload, right? You would document exactly what you gave the patient. There's some challenges with saline. I know you hang it up there, you're running it wide open, or you're running a TKO, and when is the last time you saw exactly how much volume went in? That's fair, but we should at least try to have a best estimate of saline documented at image trends so that we can monitor this important metric for our patients.